As a urologist with decades of experience and thousands of patients, I honestly believed I'd seen it all and knew most of the answers to men's health. I understood the tests, the medications, the procedures. But I was wrong. The greatest revelation of my career didn't come from a cutting-edge medical seminar, but from a very observant 82-year-old woman who was in my office accompanying her husband. As he described his symptoms, waking up several times a night, urgency, weak stream, she simply shook her head. And when I asked what she thought, she told me 4 things he was doing wrong. They were things so simple, so fundamental that I almost ignored them. But she was right. What she taught me that day forever changed how I treat my patients. And it's something most men, and even many doctors, have no idea about. I see that frustration in your eyes every day in my office. It's that nagging feeling that your body is starting to fail you. It's waking up at 2 a.m. and then again at 4 a.m., feeling like your bladder never empties completely. It's the anxiety of needing to know where the nearest bathroom is wherever you go. It's the silent worry about your performance, the fear that this is just the beginning of the decline. You hear that it's just age, that it's inevitable. You fear that the next step will be medications with side effects or talks about surgery. That feeling of loss of control is the real enemy, and that's what we're going to fight today. But what if I told you that this decline isn't inevitable? What if the key to reversing these irritating symptoms wasn't in a new miracle drug, but in 4 incredibly simple adjustments you can start making today? Imagine the freedom of sleeping soundly through the night. Imagine the confidence of a strong, steady flow, the feeling that your body is working for you, not against you. The wisdom that Lady shared with me wasn't about advanced medical technology. It was about aligning your body with how it was, designed to function. It's about regaining control, and that's exactly what I'm going to share with you now. I'm Dr. Jocelyn, and I've been a urologist for over 20 years. In my work, I don't limit myself to what textbooks and lab tests say. I've learned that true medicine happens at the intersection of rigorous science and careful observation of real life. My role, as I see it, isn't just to diagnose. It's to be a translator. It's to take intuitive wisdom, like that of the 82-year-old woman, and explain scientifically why it works. The truth is, your body has an incredible capacity to heal and rebalance itself, but it's constantly sabotaged by our modern autopilot. The enemy isn't your age. The enemy is chronic inflammation, poor pelvic circulation, and the tension you don't even know you're carrying. My goal today is to give you the manual you never received. I'm going to share with you now the 4 simple pieces of advice that woman gave me, and I'll explain the powerful science behind each one. They're all easy to apply, but I ask that you stay with me until the end, because the 4th piece of advice about something almost every man does when watching TV or lounging on the couch is by far the most neglected. Honestly, it may be the main physical cause of your discomfort and your nightly trips to the bathroom, and almost no one talks about it. Before we dive into the first one, hit the like button if you believe men deserve real, practical solutions and not just hearing it's just a phase. It's an important sign to me that we're on the right track. Let's start with the most fundamental piece of advice, the one that sets the tone for the entire day. It was the first thing she mentioned. She said, "Doctor, he wakes up as if he's in the desert." What she was pointing out was a hydration timing problem that most men completely ignore, but which has a direct and irritating impact on the bladder and prostate. This first adjustment is about how you start your day, and it can be the difference between a calm, controlled day and a day spent rushing to the bathroom with a constant sense of urgency. It's the foundation upon which all other urological health habits are built, and it's incredibly simple to correct. Her observation was brilliant in its simplicity. She said, "He's thirsty all day, hardly drinks anything at work, and then tries to compensate by drinking 2 or 3 large glasses of water right before bed. We all know what that causes: interrupted sleep, multiple trips to the bathroom, fragmented sleep that is never truly restorative." The solution she implemented, and which I now prescribe, is what I call the morning internal shower. In the first 30 minutes after waking up, even before coffee, drink 2 to 3 glasses of room temperature water. It's not about drinking more water overall throughout the day. It's about drinking the right water at the right time. Now, here's the scientific why this is so powerful, and it's something we rarely discuss in a standard medical consultation. Think about what happens while you sleep for 7 or 8 hours. Your body is in a state of natural dehydration. Your kidneys, however, continue to work diligently, filtering metabolic waste from your blood. The result is that, in the morning, the urine in your bladder is super concentrated. It's dark, full of waste, and most importantly, highly acidic. This acidic and concentrated urine is incredibly irritating to the sensitive lining of your bladder and the delicate tissue of your prostate, essentially chemically burning the area and triggering signs of inflammation. I want you to think about this very visually. Imagine that the lining of your bladder and urethra is like a small cut or a sensitive sore in your mouth. Now, imagine that this super concentrated morning urine is a glass of pure lemon juice. When that lemon juice hits the cut, it stings, inflames, and sends an immediate pain and urgency signal to your brain. That's exactly what happens inside you every morning. The flush of room temperature water you drink when you wake up acts immediately to dilute this acid. It cleanses the system, neutralizes the urine, and soothes those irritated tissues, stopping the inflammation before it even starts. This isn't just theory, it's directly linked to what we see in urological research. Many studies on nocturia, the medical term for waking up at night to urinate, show that the problem is often not the total volume of fluid you drink, but rather the timing of that fluid. Nocturia is strongly associated with low fluid intake during the day, followed by heavy compensatory intake at night. By anticipating your hydration to the early hours of the day, you allow your kidneys to do the heavy lifting of filtering during the day when you are awake and active, instead of overloading them precisely when you are trying to get deep, restorative sleep. Let's go back to that lady's husband, a 70-year-old man named Carlos. He was completely resigned, believing that waking up 3, sometimes 4 times a night was simply his new reality. He was chronically exhausted, and so was his wife. Following this simple advice, just shifting most of his water intake to the morning and drastically reducing it after 7 p.m., he returned to my office 6 weeks later and seemed like a different person. He told me with a genuine smile, "Doctor, now I wake up maybe once and sometimes not even that. I completely forgotten what it was like to sleep 5 hours straight." That's the profound change a simple timing adjustment can make. This is so powerful because it's an immediate win. You can literally change your bladder chemistry in a matter of hours. Before we move on to the second piece of advice, which has to do with what you do in the crucial 30 minutes after dinner, I want you to be honest with me. Are you guilty of forgetting to drink water all day and then trying to make up for it all at night? Tell me in the comments below. Do you think your hydration timing might be to blame for your nighttime trips to the bathroom? Type yes if this sounds familiar. The second piece of advice that wise lady gave me was about a very specific time of day, the 30 minutes right after dinner. She pointed to her husband and said, "After he eats, no matter what, he collapses on the couch. He says he's digesting, but it seems like he just shuts down." She was observing, without knowing the scientific term, one of the most destructive habits for a man's metabolic and vascular health. What you do right after your biggest meal of the day may be silently rusting your arteries and depriving your pelvis of vital circulation, setting the stage for prostate problems and erectile dysfunction. Her advice was straightforward and practical. I make him take a survivor's walk with me, as she affectionately called it, even if it's just for 10 minutes, around the block. The solution, therefore, is incredibly accessible. A light 10-15-minute walk right after your biggest meal of the day, which for most people is dinner. We're not talking about intense exercise. It's not about sweating or getting out of breath. It's simply about using the large muscles of your legs to move your body smoothly, resisting that almost magnetic urge to sink into the armchair. It's a small act of movement that pays enormous dividends. Scientifically, this walk attacks 2 deadly enemies of men's health at once. The first and most immediate is the spike in blood glucose. When you eat a meal, especially one rich in carbohydrates like pasta, bread, or rice, your body transforms it into sugar, glucose, that floods your bloodstream. If you remain still, this excess sugar needs to go somewhere, and chronically elevated blood sugar levels are toxic. They damage the delicate linings of your blood vessels and tiny nerves, precisely the vessels and nerves that are absolutely crucial for erectile function and overall bladder health. Walking acts like a glucose vacuum cleaner. Your leg muscles are the largest in your body, and as you move, they immediately begin to suck up excess sugar from your bloodstream to use as fuel. The second enemy that walking defeats is pelvic stagnation. When you sit for long periods, especially after eating, blood flow to the pelvic region decreases drastically. The prostate and all surrounding tissues are in a low oxygen, low flow environment. The act of walking acts like a muscle pump. The contraction of your glutes and legs forces blood to circulate vigorously through the pelvis, bringing fresh oxygen and vital nutrients. I want you to think of that post-dinner blood sugar spike as rust rapidly forming inside your pipes, which are your arteries. If you let that rust sit, it corrodes, hardens, and narrows the pipes, especially the smaller, more delicate ones in your pelvis, making blood flow difficult and restricted. The 10-minute walk is like using an immediate pipe cleaner. It cleans that sugar rust before it has a chance to harden and cause permanent damage, keeping your pipes smooth, flexible, and most importantly, open for business. The science on this is clear and comes from leading institutions. Research from Stanford and studies published in the prestigious journal Diabetes Care have repeatedly shown that a 10-15-minute walk after meals dramatically reduces the blood glucose response. In fact, it's far more effective than a longer 45-minute walk at another time of day. Endothelial health, the health of the lining of your blood vessels, is directly and undeniably linked to your erectile health. By protecting your vessels from this daily damage from sugar, you are directly protecting your performance and the health of your prostate. I had a patient, Marcos, who was 58 years old. He was pre-diabetic, his energy levels plummeted after dinner, and he was very concerned about his erectile function, which he felt was disappearing. He was a busy man. He hated the idea of going to the gym. I simply prescribed this 10-minute walk after dinner. 3 months later, his blood sugar levels had improved significantly. But what cheered him up most was what he told me privately, lowering his voice. "Doctor, it's like the lights are turning on again down there. I feel the blood flowing in a way I haven't felt in years." The third piece of advice that lady gave me was the most intuitive and, honestly, the most profound. She didn't use medical terms, but her observation was perfect. She looked at me and said, "Doctor, he's a good man, but he keeps all his stress down there. He's always tense, always tight." She was describing something I now see in perhaps 90% of my male patients who suffer from pelvic pain, urinary urgency, and weak stream. It's a problem called pelvic floor hypertonia. In simple terms, it's your stress manifesting physically in a place you didn't even know you could control. Her advice wasn't about meditation or an hour-long therapy session. It was a simple, direct command. I tell him to breathe and let go down there. The solution I developed from that is what I call elevator breathing or pelvic sighing. Several times a day, or whenever you find yourself tense, perhaps in traffic or in a stressful meeting, you'll take 5 to 10 deep diaphragmatic breaths. As you inhale, your belly expands. But the magic happens as you exhale. You slowly release the air through your mouth and actively visualize your pelvic floor muscles, the muscles between your legs, around your anus, and the base of your penis, melting, opening, or descending, like an elevator gently descending to the ground floor. Here's why this is a game changer for so many men. Most men, when stressed, chronically clench their pelvic floor. It's a subconscious fight or flight response. Just as you clench, your jaw or your shoulders rise toward your ears, you also clench your pelvic floor. Doing this all day, every day, for years, causes urological havoc. This chronically tense muscle constricts the urethra, which passes right through it. This is a direct mechanical cause of weak stream, hesitancy, having to wait for urine to come out, and the frustrating sensation of incomplete bladder emptying. Besides constricting the urethra, this constant tightness also compresses the delicate nerves that run through the pelvis. This sends pain and irritation signals to the brain, perfectly mimicking the symptoms of a prostate infection known as chronic prostatitis. Many men suffer for years, taking antibiotics that don't work when the problem was never an infection. It was a chronically tense muscle. Conscious relaxation is, in many of these cases, the true cure. You can't get rid of stress, but you can change how your body reacts to it. This is the most important analogy I give my patients. Think of your pelvic floor as acting like a fist tightly clenched around a flexible garden hose, your urethra. When you try to urinate, you're trying to force water through that tight fist. The flow comes out weak, irregular, and incomplete. Many men find they need more water pressure, like a medication to force the urine out. But the problem isn't the water pressure. The problem is the fist. You don't need more force. You need, for the first time, to consciously open your hand. Elevator breath is the act of relaxing that fist. In my field, the gold standard treatment for chronic pelvic pain syndrome, CPPS, which is so often misdiagnosed as infectious prostatitis, is no longer rounds of antibiotics. It's pelvic floor physiotherapy. The physiotherapist's central job is to teach men to identify, manage, and most importantly, relax and release these hypertonic muscles. What I'm teaching you now is the first fundamental step in this specialized therapy: science. recognizes that this chronic muscle tension is a root cause of urinary dysfunction and pain, but it's rarely discussed in a standard medical consultation. I vividly remember a patient, Roberto, a 48-year-old lawyer. He had pelvic pain and urgency for years. He was frustrated, tired, and had taken countless rounds of antibiotics that never worked. He was convinced he had an incurable infection. I examined him and said, "Roberto, your prostate is fine, but your pelvic floor is as hard as a rock." I taught him the elevator breathing. He came back a month later and said, "I did it in my car between meetings. For the first time in 5 years, I had a whole day without pain and without urgency. I didn't know I was the cause." This is about the mind-muscle connection. It's about realizing you have control over an area of your body that you've probably ignored for decades. Before we reveal the last piece of advice, the most counterintuitive of all, tell me in the comments, have you ever stopped to think if your stress is being stored down there? Can you feel that tension right now while watching? Comment below with one word, tense or relaxed. I want to know. And now let's move on to the fourth and final piece of advice. This is the one I promised, and it's the most physical and direct of all. It's what the 82-year-old woman told me with the most frustration, almost throwing her hands up in the air. She said, "And on weekends, doctor, it's the worst. He sits for 3, sometimes 4 hours straight watching the football game. He doesn't move for a second." She was pointing to a daily mechanical trauma that millions of men inflict on themselves without thinking. The chair trap. This is honestly possibly the biggest modern contributor to prostate problems. Her advice was, once again, perfectly practical. "I make him get up to get me something after every commercial," she said with a wink. The solution I formalized for my patients based on this wisdom is the 30-30 rule. It's incredibly simple, but it requires awareness. For every 30 minutes you spend sitting, you must stand up for at least 30 seconds. You don't need to do jumping jacks or go for a run. Just stand up. Stand up, stretch your arms toward the ceiling, sway your hips, go get a glass of water. The simple act of standing up is what matters. You break the vicious cycle of compression. Here's why this is so brutally effective, and it's pure physics. When you, as a man, sit, especially on a soft surface like a sofa or a padded office chair, all the weight of your torso, your organs, your head, all of that is channeled directly downwards into a very small surface area. And what exactly is in that area bearing that pressure? Your prostate and the vital nerve bundles, like the pudendal nerve, that control sensation and function of the bladder and penis. Sitting for hours on end literally compresses these delicate tissues. Think of it as a low-intensity, but constant trauma. Direct compression prevents oxygenated, nutrient-rich blood from entering the prostate and prevents inflammatory metabolic waste from leaving. The area becomes stagnant, inflamed, and deprived of oxygen. Over time, this chronic daily trauma can directly contribute to prostate enlargement, benign prostatic hyperplasia or BPH, and nerve irritation, leading to urgency, frequency, and pain. You can exercise for an hour a day, but if you spend the other 8 hours of your work compressing your prostate, you're fighting a losing battle. I want you to visualize this as clearly as possible. Sitting for hours on end is literally like taking a small brick and placing it on top of your prostate. Now imagine having that brick there all day, every day. The prostate wasn't designed to withstand that kind of direct, constant pressure. It was made to exist in an environment with space and blood flow, which happens when you're standing or walking. The 30-30 rule, standing up for a mere 30 seconds, is simply the act of removing the brick from it. You allow the tissue to breathe, decompress, and for the blood to flow again. Science has a name for it: sedentary time. And the studies are frightening. Large-scale health research, analyzing tens of thousands of men, has shown a direct and independent link between sedentary time, regardless of how much you exercise at other times, and a drastically increased risk of LUTS, lower urinary tract symptoms, and a diagnosis of BPH, enlarged prostate. The act of sitting itself is a risk factor. Your body doesn't care if you ran 5 kilometers in the morning if you spend the next 8 hours crushing your pelvis. This is the hardest habit to break for many men because it's passive. You don't even realize you're doing it. It's modern autopilot. I want you to be honest with yourself and with me. Are you guilty of sitting for hours on end, whether at your desk or on the couch? Have you ever felt that numbness or discomfort after sitting for too long? Tell me in the comments which of these 4 tips I shared: the morning water, the post-dinner walk, the pelvic sigh, or the chair trap, surprised you the most? And this last piece of advice, The chair trap is perhaps the most powerful of all because it's the most treacherous. It's a silent trauma we inflict on ourselves for hours on end, every day, without the slightest awareness of the mechanical damage we're causing. But look, none of the 4 pieces of advice that wise lady observed in her husband were complicated, expensive, or required special equipment. They are the opposite of complex medicine. They are about fundamentals. They are about removing the obstacles we place in the way of our body's incredible ability to stay healthy. It's a change of perspective that takes us out of autopilot and gives us back control of our own health. Let's recap the wisdom she gave us, now backed by science. First, the morning, internal, shower, using 2 to 3 glasses of room temperature water upon waking to dilute acidic and irritating urine, calming your bladder and prostate for the rest of the day. Second, the 10-minute survivor's walk after dinner, using your muscles like a vacuum cleaner to clear the rust of sugar from your blood, protecting your pelvic blood vessels and nerves. Third, the pelvic sigh, using your breath to consciously relax the tense fist of the pelvic floor, opening the hose so that urine can flow freely. And fourth, breaking the chair trap with the 30-30 rule, simply getting up to remove the brick from your prostate. That woman's wisdom wasn't magic. It was about attentive and loving observation. She saw what modern medicine, with all its focus on tests and medications, sometimes forgets. Your body is a dynamic system that responds, positively or negatively, to what you do with it every day. Your urological health, your performance, your energy, none of that is a sentence sealed by your age. It's a system that desperately needs 3 things that our modern world steals from us: flow, relaxation, and movement. Don't feel overwhelmed. Don't try to do everything at once. Just choose one of these pieces of advice. What seemed most obvious to you? And start today. Start tonight. Remember, vitality isn't a matter of age, it's a matter of action. You are in control. If this practical perspective was helpful to you, if it gave you a glimmer of hope or a clear idea of what to do, please hit the like button right now. That feedback is vital to me. Subscribe to the channel if you haven't already, so I can continue bringing you more medical advice that makes sense in the real world, translating complex science into simple, actionable steps. And most importantly, if you thought of a friend, your father, a brother, or any man you love while watching this, please share this video with him. Knowledge is the first and most powerful step to healing. And finally, as always, remember, the information in this video is strictly for educational purposes and is not a substitute for professional medical advice, diagnosis, or treatment. Always, always seek the advice of your physician or other qualified healthcare professional with any questions you may have regarding a medical condition. If this practical, real-world perspective was helpful to you, if it shed light on something or gave you a sense of hope and control, then please help me spread this message. Hit the like button right now, as this tells the algorithm that this is valuable advice that other men also need to see. Subscribe to the channel if you haven't already, as my commitment is to continue translating complex medical science into simple, actionable steps you can use to regain your health. And most importantly, think of a man in your life, your friend, your father, your brother, your partner, who could benefit from hearing this. Share this video with him. Knowledge is the first and most powerful step to healing, and you can be the catalyst for that change for someone you love. Finally, I want you to remember that although I am a doctor and share information based on science and my clinical experience, this video is strictly for educational and informational purposes. The content discussed here is not intended to replace professional medical advice, diagnosis, or treatment. Every body is unique, and your specific situation needs to be evaluated by a professional. Always, and I mean always, seek the advice of your doctor or other qualified healthcare professional with any questions you may have about a medical condition or before starting any new treatment. Do not disregard professional medical advice or delay seeking it because of something you saw in this video.